your question. Right. So if you have read and understood, considering its surgical anatomy station, kindly please tell me what image are you looking at? What is this?
This is an image showing xylography.
Okay.
Then
Xylography or xylogram?
xylogram.
Xylogram. Yes. Which side? Can you please elaborate?
Here the contrast is injected into the Jensen's duct,
Okay.
which is the parotid glands.
Duct. Yes. Of which side? I asked you, please.
Side, left side. Okay.
Yes, left side. All right. Can you please tell me what is parotid gland, and if you can describe the parts?
Parotid gland is one of the major salivary gland. It is the largest major salivary gland. It
Yes.
has superficial and deep parts,
Yes.
and the parts are separated by the facial nerve.
Okay. Can you tell me all
It
the branches? Facial nerve divides within the parotid gland into how many branches, if you can?
It divides into 5 branches.
Yes.
First is temporal, then is zygomatic, then buccal, marginal mandibular, and cervical.
Yes. Okay. Can you please tell me what kind of secretions are secreted by the parotid gland?
Parotid gland, it is a serous secretion.
Okay.
And
Yes.
submandibular gland, it is mixed serous and mucus, and sublingual, it is mucus.
You told me the parotid duct, also known as Jensen's duct. Can you tell me the opening of this duct?
It opens opposite to the upper second molar
Okay.
into the mucus.
Yes. And if you can tell me okay, you told me this, the superficial landmark of the borders of the parotid gland. If you can just tell me 3, there are 4 basically.
Okay, the superior border,
Yes.
it's from the mastoid to the tragus of the ear.
Posterior to
From there,
yes.
From there to the head of mandible.
Yes.
An anterior border from the head of mandible to the center of masseter to a point 2 centimeter below and behind the angle of mandible, and the posterior border from the mastoid to the point 2 centimeter below and behind the angle of mandible.
Okay. Reading this stem, patient presented with the swelling. Considering this, how would you rule out the condition of this patient? What tests would you ask for?
I can do the ultrasound scanning,
Okay.
also CT evaluation.
Okay. Why? CT or MRI? Which one? And why?
MRI. If I am suspecting calcification, it's better to do CT.
Okay.
Otherwise, MRI will be ideal.
All right. Considering that this patient's swelling has been painful, what would be your provisional diagnosis and what would be the differential diagnosis that you would consider?
My professional diagnosis will be silent lithiasis,
Okay.
and differential diagnosis can be divided into infective,
Okay.
can be
Infective
mumps,
parotitis. Okay. Okay.
inflammatory can be Sjogren's or sarcoidosis, or malignancy can be benign, which includes pleomorphic adenoma, Warthin's tumor, and malignant, which can be adenocarcinoma or mucoepidermoid carcinoma.
Once you're talking about the tumors, what do you know about the Warthin's tumor?
Warthin's tumor is a benign tumor of parotid gland.
Okay.
It's around 10 to 15% of
Yes.
benign
15%
tumors,
neoplasm. Okay. And
and
more important,
usually it comes around the age of 60 to 70 years, and
more
smoking is
important,
a risk factor.
yes, smoking is associated with it. All right. And normally it is situated towards the tail of the parotid gland.
Okay.
Yes. All right. When considering the tumors of the parotid gland, you already told me there could be benign and malignant. Which one is more common and why? Among which age group?
Most common is benign pleomorphic adenoma,
Yes.
and usually around 40 to 60 years.
Which one did you say? Mucoepidermoid?
Mucoepidermoid is
It's
a
also
commonest
carcinoma.
malignant carcinoma.
Yes.
Age group, I don't remember.
All right. Okay. Can you please tell me, other than the facial nerve, what are the structures which are important and are present within the parotid gland?
From superficial to deep, it is a facial nerve,
Yes.
retromandibular vein, and external carotid artery.
Okay. This retromandibular vein drains where? In which vessel?
External jugular vein.
Can you please tell me, yes, if you suspect it to be carcinoma or benign, and irrespective of the fact that it is benign or malignant, how would you manage the patient?
If it either depending on if it is a benign, we can go for superficial parotidectomy. If it is malignant, total parotidectomy is needed.
Okay. One of the side effects which are more common with paroidectomy is Frey's syndrome. Can you please tell me what that is and how it occurs and how it can be prevented or avoided?
Usually, it is because of the injury to auriculotemporal nerve,
Okay.
which supplies the parotid gland,
Yes.
which after the injury, when it regenerates, it innervates aberrantly to the sweat glands of the superficial skin, and as a result of which, whenever there is stimulation of salivation, the sweat glands are stimulated, causing excess sweating, erythema, and warmth in
Can
the
you
area.
please elaborate this auriculotemporal branch of the mandibular nerve? It carries what type of fibers?
It carries the parasympathetic fibers.
Parasympathetic. Very good. Okay. That's why it's which are scretomotor in nature. Very good.
Okay.
Yes. What happens when this nerve is injured? It leaves.
When this
Yes.
when this nerve is injured, it when it regenerates later, it aberrantly reinnervates to the sweat glands and of the superficial skin, and
Yes.
as a result, whenever salivation is stimulated, sweating is stimulated, causing
Yes.
excess sweating in the area,
Yes.
erythema and wasal and warmth.
Yes. Which causes sweating and tingling sensation. Okay. Very good. Right. What do you know about the pleomorphic adenoma?
Pleomorphic adenoma is the commonest benign tumor of parotid
Yes.
gland. It mainly affects the superficial lobe.
Yes.
Usually occurs around the age of 40 to 60 years.
Yes.
Its malignant potential is less, but rarely it can progress to malignancy.
Mostly it
Uh,
has, yes, mixed type of cells in origin. All
Mixed
right.
type of
Right. You told me about the superficial and deep parts, and the superficial part is so large or huge that it comprises of 80% of the gland's mass. So that's the most important.
Okay.
Right. I have asked you almost all of the. You did tell me about the surface marking of the gland and to
Yes.
of the duct as well. So yes, everything has been covered. Good. Thank you.
Okay.
Thanks. You can, if you want, time is here. Tell me about the blood supply of the parotid gland and lymphatic drainage, please.
The blood supply is from the external carotid artery,
Yes.
and lymphatic drainage is to superficial and deep parotid lymph nodes, which drains to the upper deep cervical lymph nodes.
Yes. Okay, good. Thank you. Very good.